The concept of Pride Month started with the Stonewall riots in 1969. These riots began in New York City following a police raid on the Stonewall Inn, a popular gay bar. Marsha P. Johnson, a black drag queen who frequented the bar, is credited with being an outspoken advocate for gay and LGBTQ+ rights. Milwaukee held its Pride celebration over the past weekend. Chris Allen, President and CEO of Diverse and Resilient, joins us to talk about what Pride Month signifies and how to support the LGBTQ+ community as an ally. Chris, thanks for joining us.
Thank you.
So for those who may not know, what is Diverse and Resilient?
Diverse and Resilient, we are a statewide LGBTQ public health organization. We focus on addressing health inequities that are experienced within the LGBTQ+ community, and we predominantly work with communities of color because at the intersections of race, ethnicity, sexual orientation, gender identity is where we find the largest inequities.
How did you get involved?
I got involved as a youth advisor back in 2002. I had recently experienced periods of homelessness myself after coming out as gay to my parents, and found support with my cousin. My cousin learned about Diverse and Resilient, and I had a friend who was also engaged with Diverse and Resilient, and so I was encouraged to really attend. And through their programming, I found not just a space where me and all that I represent was tolerated, but a space where my identities were affirmed, and I felt like I was appreciated for the experiences that I could bring.
You talk about health disparities. What do the numbers show here in Milwaukee?
So the numbers, I don't have exact numbers, but communities of color, and especially queer communities, when we're looking at rates of HIV infection and prevalence within our communities, there are high rates of HIV prevalence in the Black gay and bisexual community, Black trans women, and also our Latinx community, our gay, bisexual, same-gender loving communities. And so the rates, the prevalence that's within those communities is far greater than our white gay counterparts, and especially our heterosexual counterparts. And so when we see inequities like that, it's not because there is something genetically or biologically different with communities of color, but that prevalence is higher, and therefore one encounter increases the chances of acquiring HIV for someone. And so when we see those higher rates of prevalence, it's because of systemic issues that need to be addressed, either education, awareness, access to resources, access to healthcare, access to education, that needs to be addressed and improved in order to really address those root causes of these disparities.
I know the late Ronnie Grace was a big advocate on knowing your status.
Yes.
Is that push still going on, like for people to know their status and to get on PrEP?
Yes, definitely. So our HIV prevention and care programs take a status neutral approach to the work that we do. And what that means is that whether you're living with HIV or whether you're at risk of acquiring HIV, we have services for you and can engage you in navigating what resources are available. And so for people who are not living with HIV, it is important to understand and know what PrEP and PEP are, so that if you do find yourself in situations where you're at a higher risk of acquiring HIV, you can determine if PrEP is right for you. You can access the resources to get on PrEP. If you've recently had an experience where you feel like you may have been exposed to HIV, you can access PEP. So PEP is post-exposure prophylaxis, where you can take medication to greatly reduce your chances of actually acquiring HIV. And for people who are living with HIV, it's important to understand what U equals U means. Undetectable means untransmittable. And so if you are in care, if you are on medication and you are adhering to your treatment and engaging in care services, then you can get to a point where HIV is undetectable in your system. And research has shown that once you are undetectable, you are not at risk of transmitting HIV to your sexual partners.
I know there's been an uptick in violence against trans women. We've seen a lot of that across the nation, right here in Milwaukee. What do you think is contributing to that, and how is Diverse and Resilient addressing that?
There's a number of factors that are contributing to it. I think one of the most visible factors that's contributing to it is the increased focus on LGBTQ individuals and specifically the trans community. We're seeing some of our leaders, elected officials, appointed officials, who are villainizing our trans community. They're not seeing our trans community as full, complete individuals, and they're being looked at as if something is wrong with them. And that message is being taken in and internalized by people who lack awareness around what it means to be trans, who may feel like they don't know any trans people, and it's spurring that that if they're not like us, they're against us, or they're not up from us kind of attitude, where folks are feeling more vocal and more open to expressing hatred and disdain and dislike, and we're seeing that played out in a number of ways, in increased attacks and increased harassment and discrimination.
We only got about 30 seconds left. What's the biggest way you could become an advocate?
Become an advocate by learning as much as you can about the LGBTQ community. Find ways to support the LGBTQ loved ones that you have in your life, and just be open about your support. It's important to be a visible ally.
Thank you, Chris. I appreciate it.
Thank you.